Just to put a little pressure on you.
Well, we'll get started then. Ms. Collins, thank you for being with us today. Mr. Wood had this scheduled for us, and that things kind of lined up just right. We had you scheduled to come in and give us a somewhat of a summary of Gateway, or how its action should go, and DOT, and how it all plays together. But there about 24 hours in that time frame, Mr. Wood ran across Mr. Fontana. So all the stars lined up. We've got everybody here today, so we welcome your presentation.
Okay, I'm happy to be here. Thank you so much. I'm fairly new to the Public Transportation Division. I started in February, so I know kind of where you are and looking at things with fresh eyes, as I talked to Mr. Wood today, the other day. So I understand that. That's awesome. These were the things that I have that he. I could tell that with his body. The legislation and the resolution. The Goldsboro Wayne Transportation Authority, or Gateway funding, and the funding that's available. I promised to go. I put a lot in there about funding, but I'm not going to talk about it all. I'm just giving it to you as a resource. Some definitions. Those were one of his questions, and kind of expectations. I put PTD on the first slide. I should have gone back and added some other ones because I have other expectations for all of us together. This is, and you can't read it very well, but this is the authorizing resolution for the 3 authorizing resolutions for creating regional or multi-agency authorities in North Carolina. As you can see, most of us are formed under the first column, which is, can't read it up there either, I'm sorry, Article 25. So most things are formed under Article 25, and I gave Mr. Wood a copy of that, so you guys kind of know what that article says. But that was the formation. There are 2 other regional authorities, multi-county authorities that have their own legislation. One is Triangle Transit, and the other one is the Piedmont Authority for Regional Transportation. We have other regional activities that take place in the state, but they're usually through agreements. Okay. The other thing I gave to him was well, this is just some of the key provisions of it, and again, it's just that it may be created by a municipality, that there's funding and local options for you to have, but those are all in that legislation. But the resolution that you were formed under, when I was looking at it, the resolution may not match what the authority that's given to Gateway. And so you guys, that's one of the things I think you might want to look at is what are your expectations, and does that resolution define those and cover those? That's something I gave to Fred. With the 2010 census, there's been a real shift in funding, and I'm walking behind this, sorry. There's a real shift in funding in North Carolina. We have a huge crescent of people that have entered the urban arena. You guys were already in the small urban area for funding, but it makes a big difference in this census. The 2010 census made big changes. This is what I kind of took this from FTA, came and talked to us about that, so I kind of stole some of their slides. But the biggest population that was affected by funding were those over 200,000. And there were just changes in the formula, and people are receiving less money now than they were before. So that was the first effect. Okay, let's go. There it is. And so we see here in North Carolina that we've actually got a lot more counties that now have urbanized areas. There's actually 40 new ones that changed in the census of counties that have urbanized areas in them. There's a huge shift in our state. And what he's saying here is that for the large systems, their money was frozen or cut. For those in the 50,000 to 200,000, it remained the same or grew a little. These are the definitions of what is in the census. An urbanized area is an area encompassing a population of not less than 50,000 that has been defined and designated in the most recent census. And again, you guys are a small urban area. The rural area, which you also fall in that category with Federal Transit Administration money, is anything less than 50,000.
Can we interrupt you with questions as you go along?
Sure you can.
Okay. Now, back up that slide. So you're saying we're designated as a small urbanized area?
Yes, sir.
As far as the urban portion of Gateway.
Right, which may be in the county boundaries, but it's the urbanized area boundary as defined by the census, which has to do with population density. Okay. But these are the funding programs that FTA manages, and my office manages most of them in some especially for you. But I've included all the slides that define these, but I promise I'm not going to go over them. I'll just talk about them right here. But the 5303 and the 5304 is planning money, and planning money comes to the MPO, your Metropolitan Planning Organization in the county. So so that's one area of planning funds that you have available to you that comes every year. 5307 is the urbanized area funding for cities less than 200,000. That flows through the NCDOT, and I've got a chart a little bit to show you what money comes to Goldsboro Wayne area. But it flows through us and comes, and we just say, tell FTA just to give it back to you. All right. The 5310 is elderly and disabled funding, and it has different funding matches than some of the other programs, and is organizations besides your designated recipient, which is currently the Gateway, can apply for it and then purchase services from Gateway, and we encourage people to do that. If it's a senior center or somebody that's having funding, they can apply through this and then use that money to purchase transportation. 5311 is rural administration funding. It's formula based, so it comes back to the state as a formula, and we have to, and so we then take applications for it, and I'll show you what money you have for that. 5337 and 39 are what used to be the bus and bus facility programs, but so those are there too. So what I've done next is I've just put definitions of each of them, and like I said, I've left the presentation. If you want to have any questions about any of them, I'll be happy to let you know, to talk about them. But I thought it would be good for you to have these definitions if you had questions about the funding.
And I'm sorry, I'm the question guy.
No, please ask questions.
It is my understanding that the director and the staff would actually apply for those grants
Yes, sir.
individually based upon our needs.
Yes.
Is that correct? Okay.
They do, and they have, and I'll show you what grants they have for fiscal year 15 in a little
Okay.
bit.
And may I ask a question?
Sure.
You're not gonna- You said that 5310 was specifically for seniors, is that what you said?
Seniors and folks with disabilities, persons with
So
disabilities.
there is extra dollars out there.
For that, right.
And is that going through Gateway, or is that
Um,
through the senior center, or who holds those dollars?
Currently, there are no grants at all from this area for that.
What would it take to get that?
Well, we'll do a call for projects in September,
Okay.
and there just needs to be an application. Those will not start until July of 16. But
I'm not on the board, but I just.
yeah, well, they're great questions, because funding is a big question for all of us right now.
Going back to previous slides, and we were talking about the 50,000 small metropolitan area.
Mhm.
You said that could extend into the county?
Right. It's the urbanized area as defined by the Metropolitan Planning Organization is where that boundary is. It's not a city boundary, it's
Okay,
based
so
on-
it would be the boundaries of the MPO.
Yeah, well, yes, let's just make it simple, yes. Usually it's the boundaries of the MPO. FTA is sometimes a little bit smaller, but yes, it's close to the boundaries of the MPO. I haven't looked at yours, let's just say it is. It's close.
So the confusion from this board member is that if you've got a urban system and a rural system, which basically is the human services
Correct.
system, am I to understand then that the urban system, the city system, could actually extend somewhat out for routes into the county, as long as it's within the boundary of the MPO or a similar boundary?
Right, and depending upon, I didn't read your resolution about that, but it could, like some other cities have authority to go within 30 miles of the city. So it just depends on, I guess, the definitions of how you define your service area, okay?
And where would we find the definitions of that?
I didn't look, did any of you guys know how you've defined your service area? I'm sorry, I didn't, I'll make a note and follow up and see.
service area is defined in the resolution setting that.
Deborah, is it my understanding as long as one leg of the service is within the urban areas, fixed route service can go beyond the urban?
But that's if you're using 5311, right? Yeah, you're absolutely right, Fred. But, so, all of these are questions today, so that we can, you know, use the resources that you've assembled to look at how you,
Well, let
what
me
you
give a
want to be.
specific on that.
Okay.
My example. If the ridership and the demand was there in the urban system, you could actually have a fixed route going from Goldsboro to Pikeville, and that Pikeville is in fact within the MPO. Am I correct?
Yes, you could. And I'm gonna talk a little bit about the
Okay.
definitions, because I think that's a question. We're actually doing a study right now of a much smaller community that has a city and a county system that want to do what you have done. But the question on their table is, what is the appropriate service? Because
Correct.
yeah, and so that's the question.
Okay.
But
Okay.
could I follow up,
Sure.
Joe? I want to ask the question that so it's not really, it's not really mandatory or anything else that it be tied to the MPO boundaries?
No.
Because I'm a member of the RPO, but the MPO, they have to maintain about 50,000 residents within the MPO. And if you have a population shift, they have to take in more area.
Correct.
So I just want to make sure it's not tied into the MPO.
No.
Okay.
It's tied into funding in your definitions of service area.
Okay, thank you.
Again, that's 5307 is urbanized funding, 5310 is the senior money we talked about. And I just put these in here as a resource for you. 5311 is the rural area formula program, and what we provide with that is primarily administration support and some capital. So it flows through us an application that there will be a call for projects in September as well.
What type of capital?
Primarily, we do vehicles, we do, sometimes we've done facilities if we have the funding. It just depends on what funding's available.
Okay.
One of the things I don't have personally is a 5-year plan, so that's what I'm working on right now, so I can figure out when and where we have shortages in money and what we need to do to fill those in. But there have been some changes. You see here, it talks about the major changes in Safety Lou is there new funding areas that were designated through this 5311 program. And I tried to 5337 is state of good repair, and that has to do with keeping your vehicles and facilities up to FTA standards, but there is funding to do that. That will be another call for projects. It's expand the capacity of services not eligible. HOV lanes are no longer eligible. So they made some changes in this, not of which apply here, but it's still called the State of Good Repair Program. And most of the federal funding, I need to say that, except for the money that comes to us because we'd like you to spend it in the year that we give it to you, it's good for the year it's given a portion, that's when the federal legislation comes out, plus 3 years. So you have 4 years to apply for and spend that money. It doesn't go away, it stays there. And that's something I want you guys to know. And the 5339 is the bus and bus facility program. This is the program that took the biggest hit in the MAP 21 legislation. It decreased the most. We have so many unmet needs in the urban areas with bus and bus facilities. We just did a Ladders of Opportunity grant, $26 million, and that just barely touched the needs for vehicle replacement, things that have met their useful life and are costing so much to maintain. So but that's another funding program. Again, this is just for your resource for you later. The general responsibilities as a grantee is that you need to look to day-to-day management of your funds. You must ensure compliance. Federal regulations, grant agreements, FTA circulars. We just did training across the state, and we had 285 people come to that training, and we talked a lot about that, because as a new person, I've always been a person that asks for forgiveness, and I won't do that anymore. I need to ask up front, and the particular area that's of concern for all of us is the Buy America requirements in all of our construction projects and other projects. FTA has said if you there have been horrible examples of steel in a facility, all the way constructed, somebody looked at it, it came from Taiwan. FTA made them pay the money back, stop participating. They're really serious about this now. So understanding the Buy America in construction projects and making sure that there are no violations of that are really, really important. If you have any subrecipients, and Mr. Pate, the example you gave of somebody else coming for other money, that subrecipient falls under me, but let's say that Gateway had some subrecipients. The people walk in their shoes just like they walk in my shoes. So they have the same oversight requirements that the rest of us do. You need to submit your CNAs, FTA calls them, certifications and assurances. Those are real important. That of course is the Buy America, the lobbying, debarment. Those are things that the feds look at when we get money. And that's the circular that's talked about in. This is just some responsibilities that Robert put in there, and I'll just pick the ones that are highlighted. It's to maintain the project work schedule agreed to by FTA and the grantee monitoring and grant activities. These ensure compliance with FTA and federal requirements on the part of agencies, consultants, contractors. If you have a contract for something and you have a DBE goal, you need to maintain that oversight and that requirement. Working under approved third-party contracts or interagency agreements. Part of this is really just for staff, but I want folks like you, when you give me the opportunity, to understand the responsibility that these folks undertake when they accept federal dollars, or when you accept federal dollars. It's not just a program of giving you money and you spend it. It has certain expectations and requirements associated with it. You have planning responsibilities that you must do. The MPO needs to submit all the projects before you can apply directly to FTA, and you guys do both. You apply to me and you apply to FTA. It has to be in the state transportation improvement program. So that's the responsibility of the MPO. I don't know that, I haven't met them today, so I'm assuming they're not here, but we have to make sure that that's the only way the application can go into the FTA grants program, okay? So those are real important. We've got environmental responsibilities, and you guys have a brand new facility that's funded with Tiger 5. Before you got that, you had to have gone through this environmental process and get probably a categorical exclusion, most likely just based on what I know about the project. But those are things that we are responsible for in terms of environmental responsibilities. Now, what I did here, I'm through with Robert's slide, but I thought you might want them, is to talk a little bit about funding. And the way, if you look in the upper left-hand corner where it says Gateway 5307, the person that oversees that for me showed me the history, or shared with me the history. And that money comes to DOT, but we in turn provide FTA with a letter that just gives it right back to you. Okay, so that they can actually apply for the money. And if you see in fiscal year 14, $794,000 were came to Gateway. We don't have the 15 money. We haven't done the 15 apportionment yet because we can't do it till the federal budget or the appropriation tables are issued. And in the bottom half are all of what I have identified as active grants that actually go from this year. The first one is a jobs grant called JARC, and you have $180,000. It's a 2-year grant, so that program will still run through fiscal year 15. You have some funding from us in the 5311 program for administration, operating, and capital. So you can kind of see the money that comes in through that. You also have the planning money that I talked about earlier for, what's that, $41,000, and then we had did another call for projects. When money's not spent, we don't ever want to give it back, so we did another call for projects, and you got funding for 2 vehicles. that you just got this spring, and so you apply directly for FTA for that. You have your Tiger grant. They have the Tiger grant for the facility for, it's 13 million. And then we have 2 state funding programs. One is called SMAP, which is called the State Maintenance Assistance Program. We just got the state budget last Friday, so I can't tell you what the fiscal year 15 money is going to be, but this is the 14 amount. And we have the same type of funding for the rural area. It's called ROAP, Rural Operating Assistance Program. So it allows you to purchase services for people that do not fit in one of your funding agencies, or to provide transportation. So let's say they're not Medicaid eligible, they need to go to the doctor, or they have a work trip that they need. These monies are set up to meet those gap transportation requirements. Right. Are there any questions about that?
Yes.
Okay.
If you said person was a part of an agency, then how would that person access the system? Who would they just call the office and say they needed? And what kind of proof, would they have to provide proof that they had a need, or just express that they had a need?
Depends on what kind of trip it is. If it's out in the county, anybody, and it's called rural general public, anybody can ride the system for a fee, and there's really no certification process. If they want to ride as an elderly person, then they would, I assume, and I'm not just being the first, I assume there's a process that they would have to provide some kind of documentation that they qualify as an elderly person or as a disabled person.
So I'm elderly and I needed a ride to this meeting.
Yes.
What, just use me as an example. What
Depends on
would,
where you live, first thing.
okay,
If you lived out in the county, I assume, and you guys could correct me, they would call, and you would have to be, we would need some kind of documentation from you, at least the first time you rode, that we would know that you qualify as an elderly rider.
showing you my driver's license and I was over what age? What is that? What,
Is it 60?
60 years old?
60 or above.
So there are
Thank you.
lots of ways to look at this, and that's one of the things that I'm doing at my level, is trying to figure out how to maximize all the dollars. And that's why I wanted to show this to you, because I think that this is an opportunity for you to look at that too. Use these the best way and leverage them against each other. Because some of them can be used for that, for matching purposes. My money can be used to match state dollars. So all of that is, I'm saying my money, state money, can be used to match your federal dollars. So this is just an opportunity for you to look at that, I think, and how that works. But the next thing I was asked to talk about definitions. Again, I've given you every definition I could find that we talk about. But the two Mr. Wood asked me to talk about was demand response and fixed route. Okay? Demand response transportation, it is called several things. Sometimes it's called paratransit. Sometimes it's called human service. All of those fit together under the definition of demand response. And what that is when you call the Gateway office and book a trip, and you agree to a time that they're going to pick you up and drop you off, that you can then so it's an on-demand service. All right. So we try very hard, and my biggest thing lately is we've got to do that efficiently. So we can't be running taxi services. We're into coordinating and consolidating as many trips as we can. But that's the definition. It's just on demand. And in most of our organizations in the state, and we have 82 rural or demand response transportation systems, most of them work through some type of expectation of coordination. And they are funded through contracts with human service agencies, whether it's Medicaid or so all the trips have a billing source. And Fred's example for you, sir, is that you would fall under he would use the rural general public as a funding agency, and that would be who that trip fell under. So everything that they do has to have some kind of funding source to keep that pays for that service. Okay?
One of my concerns is the labor intensiveness from agencies and from Gateway regarding the scheduling process. It seems antiquated. And is there software available that the agency could actually go online and actually book a particular citizen to use that service that would then be inputted to Gateway for Gateway to pull that up and schedule it?
Yes, sir.
Is there that service available
Yes, sir.
through software?
Through software. And you
Rather
actually have
than
access to
emails
some of that.
and telephone calls and so forth, it's actually inputted by the agency themselves.
Correct.
Now, there's no question in regards to whether or not it's authorized. If in fact the agency inputted it, now I don't have to run into a problem of checking to see whether or not it had proper authorization.
You still probably have to have the documentation if they
Sure,
require it.
sure.
Yes.
But the point is that I have heard horror stories in regards to the time involved with all that between agency and Gateway of doing that. And we've just got to come up with a more efficient way of doing that. Taking it one step further, if in fact an agency could do that, why could a citizen not do that?
They can.
They can. So they could have access over the internet to access, or the telephone, to actually schedule that. Correct?
Yes.
Thank you.
They can. There are also different ways of, I came from the universities, and I worked there for a long time, looking at efficiency. There are also ways that we tend to treat this service and our agency clients and not try to negotiate with them or not try to set parameters. My parents are getting older now. They are not going to schedule their doctor's appointment at a time that I can't take them, right? So if I take that model and put it on Gateway, there are ways to look at, I'm gonna be in your community at 9, 11, 2, and 4, right? And so you need to schedule your appointments to meet that transportation. There are just a whole plethora of ways that you can look at how to make the system more efficient. And we're gonna have to as we have shifts in funding. But we've been so used to, as an industry, not just in North Carolina, but as an industry, at trying to meet the client's needs because we grew up in a human service environment in most cases. And so the client's needs are really important, but the client needs to be willing to work with us to provide efficient transportation.
Would that software have some of those parameters laid out?
Some of them can.
Could you?
Some of them can. Others are not as good. I know my staff, when I was at the university, did a study of one of the cities, and by just having a schedule in, I think it was eight corridors that we served, we were able to get everybody onto that system and honor their time. This was, of course, science. You know, it was just taking data that already happened. But we saved 1,000 miles a day in that system. It's a pretty big system, but still, you know, even at $1 an hour, you're talking about $250,000 a year.
Sure.
So that's why looking at efficiency is just really important. And those are great questions around that, and what tools you have.
Question,
Yes,
please.
sir.
It's talking about efficiencies. Do you have experience, I've been sort of suggesting to Gateway about the possibility sometime in the future of having satellite locations rather than operating from one hub, is to have a satellite like in the northern part of the county, one in the southern part. Is that something that you have experience with, or is anyone else doing that?
I think you have to look at your trip patterns to decide if that's an effective alternative, because if you're just putting people out there to come in to get people, it's not as effective. But if you're operating in those areas, it is, and we do have a few in the state. I guess personally, as an oversight person, now that I have that hat on, drug and alcohol is one of our oversight requirements, and one of those is reasonable suspicion or fit to duty requirement. And so sometimes I worry about people outposted because we have had a death in the last 18 months where the person wasn't being seen regularly. You know, are they fit for duty? And that's one of the drug and alcohol FTA requirements that FTA has.
Well, as it stands right now, like up in Fremont, in my district, if you only got one that you're gonna go pick up, bring back. You got 2 trips there and back. Where if you had a satellite location and you didn't have a fixed route, you did based on who needs you, wouldn't that save travel miles, wear and tear on our vehicles?
It could.
And we're
We have
already
to look at
servicing
it.
those areas. These are areas that we're already servicing. That's what I'm saying. So, it may not be in the immediate future, but I think that we could save some money by doing that.
Well, I think now's the time to be looking and asking all these questions. I think you start first with your current trip patterns
Yeah.
and look at where they are and they may be and where they're going and see if that works. That's a great question. Thank you for thinking about it. So here are all of the definitions or things. Dial-a-ride is sometimes another definition for demand response. People call it human service. Fixed route. I want to talk for a minute about fixed route because fixed route implies that you have a fixed schedule and you publish that. So you're saying I'm going to be at this stop and this stop and this stop, and it is just that. You have people that board at the stops and you take them to other places. The reason I want to focus on it for just a minute because of the Americans with Disabilities Act, and I know you guys have heard of that in other parts of the county's programs, but in transportation it means that when you operate fixed route, fixed schedule service, you have to also operate a service called complementary paratransit. In other words, you have to give them access to that route. So that is another thing that Gateway has to do, and I'm sure does, and they have to have a plan for it and to operate that service and of course it's eligible for their federal funding. But they're required as a fixed route, fixed service provider to operate complementary paratransit. Okay, and there's the definition of that. It's very definitive about what you have to do. There's 6 criteria you have to meet. You got to have an eligibility process. It's not an easy thing to oversee. In smaller communities, I ask them constantly because of the administrative requirements to look at other service models. But I want to talk a little bit about us. We are shifting as the new person. I get to say that. We're going to be organizations of possibilities. In the past, we have been organizations of closed-loop planning, and so we are really working hard to look and flip the pyramid and look at how we do things. We know there are new regulations, there's new funding, and we know now that we have a higher, with MAP 21, FDA has pushed a lot more oversight to the state level. So we know we have to do that. So we're working hard to get that up. This is a partnership that we have. And with that, we ask our staff when they come out to come back with one good story. You should be able to hear one good story when you go somewhere. So we can push that out and educate, not only educate the population, educate the legislature. We want them to hear all the good things that are being done by the transportation systems in the state. This is a vision that we have to work on together, and we're hoping it's going to take about 18 months to get some big changes together. I'm working hard to get the right people in the right seats. I think in my organization that's critical, and so I'm charging all the transit systems to do the same thing because this is 2014. Everybody needs computer skills, and I'm making them go to Excel classes. They're not very happy with me, but it is 2014, and we need to have those skills. Our processes are, and I'm asking systems to do this, to simplify them. When Gateway puts in an application for funding, it's so great, it comes into an automated system, but guess what? One of my staff retypes that number 8 times before it gets to the Board of Transportation. So we've got to collect once and use many. We can't, and all of us need to do that. Our workflow has got to be checked out. We're so used to doing things one way, but that, we're in a different time. I was meeting with the CFO this morning, and he said, you can't think like that anymore. So none of us can think like that anymore. We've got to look at our workflow and how things happen. Data systems and reports include data that's simple to maintain, can be documented, and able to be replicated. With one of our audits, I had 3 audits in the first 3 weeks, and one of them had some major findings for us. So we were working to correct those, as you always do when the auditor comes. But we asked the systems to submit data to us to validate the data that they had reported to us. Do you know that only 40% of their documentation met what they reported to us? 40%. That's a problem for me. Now, my staff is freaking out because they go, I have several millenniums, and they said, this was just a waste of time. And I said, well, no, look at what you've learned. We have learned that we have to be asking more questions and better questions. And so that's what that's about. Again, we're reorganizing. I've got a whole new unit that I'm trying to staff and put together. I'm asking the systems to look at that. They may need to do the same thing. Grantees. These are the things when we train those 285 people I talked about. Know your funding. These guys need to know their funding and what they've applied for and what is eligible for it. We will be disallowing things that aren't eligible. Well, I don't think we've done a great job with that, but the FTA would definitely be disallowing from us. But in this 5311 program, which you guys have 3 funding categories, operating, administration, and capital, we had an incident. This is a formula-based program, so FTA gives the money back to North Carolina based on what we tell them we're providing in service miles and hours and passengers. Well, we had one system that defined their service as a taxi, and FTA says, you can't report their data. Well, that means all the things that we fund that they do, we can't get money back now for it. So we've got to know our funding. We got to hold people accountable, and luckily it was just one. But you need to understand your funding too. In MAP 21, it defines clearly that we're providing shared ride transportation. That's what I talked about earlier about coordinated, consolidated service, not one-on-one trips. And in the 5311 program, that it's definitely in the non-urbanized area. So those are funding scenarios with that. I'm asking folks to have a 5-year budget. I need one. I've got a consultant working with me to look at all the funding we have to try to maximize it because people are shifting from one funding source to another. We've also frozen funding for years, and when I look at the grants as we take them forward, there's no rhyme or reason why this person gets this and this person gets that. So we'll be looking at how we distribute money. But we're asking everybody to have a clear vision and a 5-year budget, and the year that we have planned, your planning planned, that you have your match. Because that's the only thing we ask of you is to give a 10% match to your 5-year plan, okay? Back to your question about software, we need our accounting systems to be providing the reports we need to report to me for invoices. My folks are telling me they're spending 40 hours on one invoice at the system level. That's crazy. I ought to be able to run a report that mirrored what the grant was and to set that up. So we're asking everybody to please, please take this time, and you might have to think a little bit differently about how your accounting system works, but this needs to happen. DOT, and I'm sure for those of you that heard the chief today, we're a data-driven organization, and FTA is too. And if you follow the FTA news, everything is going to have metrics of different things. So whether it's planning, whether it's asphalt, we're all going to be tied into a data-driven process. So we need to look at our data that we're collecting and make sure it's correct, and that it's based on the service that we're delivering and not scheduling. We have a program called Fully Allocated Cost. That defines what your cost for service should be, and we want you to work through that model and to make sure that the billing rates are reflective of your costs. A133 audits, that's the one I told you about that they found 5 things on us, which is always fun. But they're performed annually, and what I've learned in that for the first time is that even though you have an A133 in Wayne County, the transit system's threshold might not be above that. Where they have to look at eligible costs, and so that's why we're having to make some adjustments on our side. But we need to look at the A133 audit and a cost allocation or indirect cost plan. I talked a little bit about this. Procurement, we got to follow the processes, and things that are funded with 5311 and 10 money definitely have to be approved by us. We got to work with Buy America. I put my procurement specialist phone number and name in that application because again, the FTA just loves to tell us horror stories when they get us together about that. Let's see. Invoices, we're asking for supporting documents. We want you to know your eligible costs in our accounting system. It's called a G-code or UPTIS. We're going to require quarterly reports, and we aren't going to reimburse unless those reports are submitted. I'm begging and begging for data. I shouldn't have to beg. If you want the money, then you give us what we need to meet FTA's requirements. So we also have some annual expectations for reports. Those are critical.
Is that quarterly report, is that a new requirement?
It isn't new, but we've been lenient, and we've just been begging you for it. So now when you submit your invoice, it comes with your invoice, and if it's there, you get paid. If it's not there, you're not getting paid. And so that's just how it's going to work.
Well, you don't have to beg anymore.
I won't have to beg anymore. I know, that's the whole point. We aren't begging. We need reports from your software. Again, that drug and alcohol report is critical. AssetWorks is a statewide vehicle maintenance application. We just had an FTA review last week. And we have oversight of equipment. We have over 2,100 pieces of equipment that we have oversight with. So we have this statewide application that we use, everybody uses, but it's required. Incidents are required to be in there, but I will say that workflow in all of our organizations need attention. If your organization requires you to have a purchase order and a requisition to get work done, then you better back up 2 or 3 weeks before you start planning earlier for that maintenance, because you know your average daily miles, so you know when you're going to hit those thresholds. So we hope to add another one of our requirements, which is training to this application. That takes away from quarterly reports. We just go run it. The other thing I talk often about is spreading miles across your fleet. It seems that if I buy a new vehicle, that's the only one that's driven. So we replace vehicles by miles. So then we have these older vehicles with almost at the threshold miles that we can't replace. So we're asking you to spread it.
Let me ask you about AssetWorks.
Uh-huh.
Is that in operation currently on our system?
Yes.
It is.
Yes.
So we're using that to actually provide the maintenance on all of our vehicles. Is that correct?
And not speaking, but I know where I was, and I assume same thing here. It should be used to determine when your next preventive maintenance is necessary and give your keep track of fuel usage and essentially mileage, how many times the wheelchair lifts are used, things along those lines.
So you're familiar with it, and we would definitely implement that and use that.
If Debbie wasn't here, I'd say something really, I might use a bad word to describe it, but I'll be clean right now. It's very, to me, it was not very user-friendly, and I hope, and Deborah's been in it from the very beginning, and I think they're making efforts to try to make it a little more user-friendly.
When we purchased it, it was the only web-based application that we could find that was a vehicle application. This was 5 years ago. So we're committed to it, and we're going to be using it. So.
And it is required?
And it is required.
Okay.
So we have some asset management expectations that we have to do for MAP 21. We're working on those. There are inventories of other things that we have to do. Scheduling software, we use it to define and maximize service, submit reports that are required, and vehicle utilization data. So those are some of the things that come directly out of your scheduling software packages, and we're requiring everybody to have one. You guys have one.
Are you requiring a specific scheduling software, or do we have an option?
In North Carolina, we've taken the stance that if you don't choose it, you won't like it. You can hear the maintenance thing, although they were on the selection team. So if you don't choose it, they don't like it. So we've let you choose your own, but it has to be certain reports that we require to come out of it. Okay. And then these were just some thoughts I had for you. I don't know that you were asking me that, but does your resolution reflect the legislation and your expectations? I think now is the time to look at that and look at it. Is your organization structure and your support appropriate? And I put, are the right people in the right seats? Is funding distributed appropriately? You know, the city and county each have a role in here. How is that role defined? And should you consider a sales tax or a vehicle registration tax? Those are the tools that you have from the legislature to fund public transportation. Do your budget and data systems meet the reporting requirements? Again, I want to get away from 40 hours to do one invoice. That's crazy. and what service delivery models should be explored. So these are just kind of the thoughts, and those are just references for you. And there may be some others that you have, I'm sure, but just in preparing for these are the ones that I thought of.
Deborah, can I ask you a question?
Sure.
It's a concern that I've always had. Use of vehicles that were purchased with rural funds. And in a joint city-county program like this is, there may be use of a rural vehicle strictly within the city limits of Goldsboro to do a human service trip. Is that going to raise all kinds of red flags, or how are we supposed to be dealing with that?
Fred, you know, I probably need to ask somebody to say, you need to ask somebody besides Steve. What I know about it is as long as it's not scheduled to do that. If it goes in once or twice a day or a week, that's okay. I think the definition is one end of the trip is in rural, right? Isn't that the
Because I can
definition?
see that happening a lot, especially with human service,
Right.
and assuming that a large number of the trips are Medicaid, and probably most of the riders would be living within the city limits of Goldsboro, within the urbanized area, that could indeed happen quite a bit. And I don't want to get busted for
Well,
doing that.
we just need to look at your fleet mix and what it was purchased from, what funding was used to purchase it first. I think that would be a starting point. Okay, that's a great question though, Fred. Thank you for thinking about that. Anything else?
There's always questions.
Okay.
And I'm understanding under our current operation, we have the larger buses that are on a fixed route, but we also have some other smaller buses that are on a fixed route as well in the city of Goldsboro.
25 footers on a fixed route.
25
That's the
footers.
smallest, yes.
And are they kind of like a feeder into the larger routes, or do they come into,
They all have separate routes, and all come back to the transfer station.
they all come back to the transfer station? And if I'm understanding your question, Mr. Fontana, that the human services side operating within the city may actually have vans that are purchased from rural funds operating within the city.
That's correct, and that probably happens all over North Carolina,
I would think so.
especially in counties that have both an urban area and a non-urban area.
Yeah, we use different funds sometimes to purchase vehicles in those environments. So I just don't know off the top of my head what was used to
So
purchase.
as long
your
as,
vehicle.
and I know like when I was in Wake County, I think a lot of the vehicles were just used with state money only,
Right.
and didn't have a federal piece to it, which
Correct,
made it easier.
right. And I haven't looked at your fleet, Fred, I don't know.
And am I understanding you to say that our resolution, our agreement between the city and the county, our resolution, should in fact reflect our expectations and so forth?
Don't you think it should?
Well, I do, because I think basically it has I think it's a two-page document, and it does not talk about some of those issues.
Right.
Uh,
I actually have it.
You do, isn't it
And I-
2 pages? Maybe 3.
It might be a little bit, the one I have might be a little, oh no, I accidentally put it on. No, it might be 3.
But it really doesn't talk about any of those discussions that you were talking about. It just really kind of talks about the priorities of the urban system and the rural system and so forth.
Right, but I think the
they
relationship.
make up the
you
ball.
have- Right, the relationship you have and how you fund things and how decisions are made, I think those are really important. And I didn't really find them there, but maybe I read it too quickly. I could have.
I didn't find it there either. Did you see that?
Yeah. Well, if the vehicles themselves come through grants, is that right?
I
Most of
think
the time.
most of them do come from
80%, 10%
What
state, 10%
difference does it
local.
make whether they're used in the city or the county?
It has to do with what I showed you before about the funding source and knowing it and understanding the expectation of that. That's Fred's question and concern and something we need to
And
look at.
that's one of the problems with necessarily with FTA, but when the funding programs were started 30, 40 years ago, there really it wasn't the interaction between urban and rural. Quite frankly, and Debbie probably will agree, the federal urban-rural distinction is a little bit archaic in the way the funds are allocated, because there really are no city limit. You don't have a wall around the city anymore that would, you know, people go back and forth between the county and inside the city all the time. But unfortunately, the federal program that funds all this transit hasn't really adapted, at least in my mind, to meet that change. Would you agree, or Debbie? to some
Well,
extent?
Fred, they're switching them over to 5307, and that's in some areas. But for those trips that have one end in the county or in the rural area, it's still, rural funding is still okay. It's just hard to work on. The great questions, though.
But it just doesn't make common sense to me to utilize, use the vehicles up by overrunning them in one area when you can save dollars by shifting. I mean,
I
I'm
know.
from the private sector, by the way, so it may not,
It's just.
it may not make any sense to me. you know?
It's just the funding stream.
Yeah, I know.
And we just need to understand it and then create the model to deliver it.
Well, it's costing the taxpayer money, though.
Yeah.
Excuse me.
Sir. Yes,
I
sir.
think where the confusion is, I live in the city of Goldsboro, but I'm also in the county. So it's gonna be hard to separate me to say I can't use a van because I live in the city limits. I'm still in Wayne County. And I think that's the way this board have operated over the past years. If you live in Wayne County, you can request service from the rural
Correct.
section, because, I mean, I pay county taxes and I pay city taxes, so I'm authorized to use either facility wherever I am.
This is,
And that would be a nightmare to try to say, okay, where do you live on Slocum Street? Do you live within an eighth of a mile of this? No, that wouldn't work.
yeah, it would be tough. It would be tough. It's a shifting time. We're all trying to understand it because, as I said earlier, we've had 40 counties are now considered urban in the state. New counties, with the 2010 census. So we're talking about over half the state has some urban pocket or population. Anything else? Did I answer all your questions? Did I hear them correctly? Okay.
Yes.
Man, there's a lot.
I think everybody's goal here is to operate as an efficient, efficient, as well as user-friendly system as we can use. I mean, I've had a lot of complaints in regards to the fact that you have to schedule so many days out in order to get service. And that when they get the service, it's so many hours before my actual appointment. And then after my appointment, I gotta wait so long in order to get a ride back home. And we've gotta recognize that what we need to do is to be user-friendly. Now, I realize we can't be all things to all people, but we have got to do everything we can to make the use of our system as friendly and courteous and nice and enjoyable experience as we can. Wouldn't you agree?
I agree. Public transportation in North Carolina is going to be key to our economic development. And you're absolutely right.
Well then, Mr. Fontana,
Yes, sir.
a fixed system, a fixed route, where persons could predict what was gonna happen, is that the best? I mean,
It depends on what your population densities are. I mean, it costs a lot to buy a bus, and if the bus is just running around empty all day, that's not very.
Oh, I've heard those complaints too.
That's not very efficient either.
Me too.
Yours is very flexible, whereas a lot of times where a van could deviate from a certain route and pick you up in your front door, a lot of times it makes sense. I mean, it's something that obviously everybody's looked at, and there's probably everybody, you ask 100 different people to give you 100 different suggestions on how to do it, but, you know, it just depends on, there's so many factors. I mean, sometimes it makes sense, sometimes it doesn't. And that's, you know, that's one of the things that I hope to look at. You know, some things, it's gotta be user-friendly, but sometimes a lot of it is educating the rider, where some of the trips where you might be wanting to go to Walmart, well, you may, if you try to get a ride at 8 o'clock in the morning to go to Walmart, you may not be able to do it because you've got people going to doctor's appointments or work or whatever. But if the dispatcher or whoever can tell that person, look, our schedule is lighter around 10 o'clock, you know, if you could go to Walmart at 10 o'clock instead of 8 o'clock, then you won't have to be there and, you know, get your ride an hour earlier or wait too long when you're done. So those are kind of things that I think we all need to be looking at as well. A lot of times you can do that.
Here's kind of some of my thoughts on that, logistics. Whether you're moving, be careful how I say this now, whether you're moving boxers or whether or not you're moving individuals, it's logistics. And if you look at most transportation, whether it's rail, trucking, airplanes, most transportation basically has a point of origin feeding into a hub and from the hub disseminating out. I mean, that's what I always see. If I wanted to fly from here to Charlotte and I got in Greenville, they would, I'm sorry, to Miami, they'd fly me to Charlotte, from Charlotte somewhere else, but there's a hub generally. If I'm putting a package from here to California, it'll go from here to Raleigh, Raleigh to Memphis, Memphis on in. So they're using hubs in order, and evidently it's the most efficient way of doing things. So I'm just wondering whether or not it may be more efficient to have a fixed route. And just an idea, I didn't say do it, I just said whether or not it may be more efficient to actually have a fixed route between here and Mount Olive, feeding into Goldsboro, and from Goldsboro disseminating out to Walmart or to the hospital or wherever. So those are the things I would hope that we will examine.
Yeah, I definitely need to look at some, and there are examples across the state where that has been done, where they use a fixed route to get to a certain point, and then
It's up to the individual to get to the fixed
distributed from
point.
that point, because you may have 20 people going from Goldsboro to Mount Olive, then once you're in Mount Olive, 5 may be going south, 4 may be going west, and that's when you use the van. So there's various, that's been done.
But you're going
many times.
to examine all of that here in Lake County?
Absolutely.
Okay.
Well, Mr. Mayo has spoken earlier and championed that, having a satellite location. And this, I'm just sitting here thinking, it sounds like some version of a combination of a fixed route and maybe a satellite location, because if there's gonna be a certain amount of ridership between Mount Olive and Goldsboro for things, but not critical. This is all the way if someone needs to go shopping, yes, they need to get the groceries, but if someone is going to dialysis, and I had a dialysis gentleman across the street from me here, and I saw him getting on, and I saw folk having to help him get off. So some sort of a fixed route would not be feasible for him, but if someone was going to get grocery and things like that that was not of a critical nature, I could see that it's sometimes a combination, but yet something thrown in about that satellite location attracts me, because then we could respond more humanistically to, say, a dialysis patient or someone who was on the way to a doctor's appointment who needed assistance to get to the doctor's appointment.
There's pros and cons about the satellite locations. I mean, one concern that I've heard, is you lose control of the vehicle. You know, there's been instances elsewhere where, a driver takes the vehicle home at night. Well, then they may use that for their personal needs.
They don't take it
And
home.
there's nobody really monitoring it.
Well, that's called a GPS that you put on there.
We've got buildings up in the northern and the southern part of the county that are available.
And the rescue, they don't
And
take
that's
those
what has to be
But
done.
the biggest problem I have, because I'm in the northern part of the county at Fremont Pike, Eureka, in that area, is that my people, if they have a doctor's appointment, they gotta wait that 2-hour envelope in order to get picked up. And that's unacceptable because the person has a doctor's appointment, they go to the doctor for a reason. They're sick. Do they need to be sitting outside at a gateway pickup point? That's my point. The satellite location would take care of that. Exactly what Mr. Camardi is talking about is citizen service, or a combination of the fixed route and
Yeah, right now, I'm open for any and all suggestions.
Right.
That's why we just unleashing today.
Now, I've had the case.
And I may still come back tomorrow.
Well, and that's true, but in my case, I've had on 2 occasions that a person that was riding Gateway, because of their circumstances, in this particular case was a wheelchair, called Wayne Net, which is OES, and they came and picked them up. Now, is that acceptable? If they ride one way on Gateway, but they can't get the service because they're sitting outside of a clinic for 2 hours waiting for Gateway to come by. Okay, I've had this happen twice. Citizens in my district, and most people sitting here know what I'm talking about. I'm not sitting here complaining as much as I am disappointed at what the citizen is receiving. No matter
And
if
I'm
it-
sure it also costs the taxpayers a lot more money to use the OES service than the Gateway.
Well, Mr. Joe Gurley sitting here is ex.
We would rather use Gateway.
And we would rather use Gateway, I agree, but the service is the key, and we're gonna do whatever it takes in order to get better service. So,